If you have a surgery coming up, you need to know your A1C. Do you know your A1C? Do you know what A1C is? Let's discuss what it is and what you need to know about it before surgery. A1C is a lab value that your doctor can order, and it gives you an average of your blood glucose over the last 3 months. When people check their blood sugar, just typically with a little pinprick, it gives you a snapshot in time as to what your blood glucose is. But as you can imagine, that's very dependent on, did you just wake up? Did you just exercise? Did you just eat? Is it the middle of the day? All of those things make your blood glucose go up and down, up and down. So having your A1C gives an overall average of what your blood glucose has been. This is what we use to diagnose prediabetes and diabetes. And why it's important for surgery is that studies have shown that if your A1C is greater than 6.5 or 7, you have an increased risk of complications, things like wound healing issues, infections, delayed recovery. And that kind of makes sense, right? If your A1C is high, that means that your blood glucose over the past 3 months has been high. And we know that having excess sugar can increase inflammation and decrease your body's ability to heal. A1C is so important that for a person like myself that does elective surgery, if we have a person whose A1C is over 7, we will oftentimes delay that elective surgery until their blood glucose can be better regulated to decrease their chance of having complications. But even if your A1C is normal and you're not considered pre-diabetic or diabetic, it still is very important to keep your blood sugars in check around the times of surgery. There are studies showing that if your A1C is diabetic level and you have high blood sugars around the time of surgery, you do have an increased rate of complications, even an increased risk of mortality after surgery. Interestingly, in that study, the risk of mortality if you have dysregulated blood sugar was higher in those who were not diabetic than those who were diabetic. How do you modulate your blood glucose after surgery? We've talked about how surgery is a catabolic experience. It breaks down proteins. It creates glucose to allow your body to heal. Also, you're in pain, you're sleeping poorly, you want sugary snacks. So all you can do is control what you are in control of. Things like making sure your sleep is as efficient in quality and the quantity is as good as possible. Making good nutrition choices, choosing lean proteins and grains and fruits and vegetables as opposed to carbohydrate-rich pastries and donuts and things like that. Also, make sure that you have an idea about what your glucose levels are going into surgery so you know if it's something that you do need to be more careful about.